Could increasing Oregon's beer and wine taxes reduce excessive drinking in the state? That's the question that a 2021 study asked. And it was a really important study for questions happening in Salem at the time, around whether or not to raise those beer and wine taxes. But despite the study's relevance, it never got published. My name's Sammy, I'm the reporter at The Oregonian who broke that story, and I'm going to walk you through what I learned. So this 2021 study found that if Oregon raised taxes on beer and wine from some of the lowest in the nation to some of the highest in the nation, that could reduce drinking overall among Oregonians, maybe by about 5%. But it would have a much smaller impact on the Oregonians who drink the most and who disproportionately drive the social costs of alcoholism. So when I started asking the Oregon Health Authority about why they didn't publish this report, they apologized that it never went up and said that, in the middle of COVID-19, their staff were pulled onto other projects and that this had kind of inadvertently fallen by the wayside. Well, new emails released this month show that that isn't quite the whole story. In fact, the Oregon Health Authority had this report in early 2022 and delayed publishing it at the same time that it was working on its own proposal to raise beer and wine taxes in the state. Again, the Health Authority has apologized, and its new director, who wasn't there when this report got buried, has said she's working to get to the bottom of what happened. But the drama is still playing out. Republican lawmakers have been really unhappy with the Oregon Health Authority after learning that this report was buried and have called into question the agency's credibility at the same time that they're relying on the Oregon Health Authority to give them accurate information around drug use so that they can reform Oregon's drug use laws. As recently as this week, Republicans in the legislature asked Governor Tina Kotek and the Secretary of State to audit the Oregon Health Authority, in part because of this report. Now, I don't know yet whether the governor has any intention of acting on that, but stay tuned with The Oregonian and I'll let you know what I learn.